The tools needed to measure blood pressure are a stethoscope and a sphygmomanometer. The subject should rest at least for 5 minutes before measuring the blood pressure. He or she should not consume caffeine or nicotine for at least 30 minutes prior to the blood pressure assessment. The subject should be seated with the back straight and supported on the chair, with the feet uncrossed, flat and firmly on the floor. The left arm must be bared, supinated and elevated at heart level, and being placed on a rigid surface. The proper cup size should be chosen depending on the subject. The cup should be labeled with infant or adult size. The cup should be wrapped around the left upper arm. The artery mark of the cup must be aligned with the brachial artery. The stethoscope ear prongs must be facing outward, and the stethoscope bell should be placed over the brachial artery and not underneath the cuff. The valve of the cuff should be totally turned to the right, and the ball being compressed several times until reaching 180 to 200 milligrams of mercury. Then, the valve should be slowly turned to the left, releasing the air at a rate of 2 to 5 milligrams of mercury per second. The first sound heard is the first carved cuff sound, which is the systolic blood pressure exerted against the artery wall when the heart beats. The last sound is the fifth carved cuff sound, which is the blood pressure exerted against the artery wall while the heart is resting between beats. The time frame to detect blood pressure goes from 3 to 5 minutes. The following charts demonstrate the blood pressure categories and values that goes from normal, pre-hypertension, hypertension stage 1, stage 2, and hypertensive crisis, and the subject's blood pressure classification.